All right, this is going to be a super quick video on setting up the vent for BiPAP. Hopefully we all are really aware we use this for really fatigued CHF and COPD patients. You can see I've got my menu here. I'm going to turn it down to CPAP. Now I'm in that mode and just going to wait for the patient to take a breath. So right now I've got PIPA 5. I'm going to change my pressure support, put it up to 10. And hit the check mark, and then I can hook it to the patient. All right, I don't have anybody here with me, so right now I'm just going to be waiting for the patient to take a breath. I got a pressure support of 10. I got a PIPA 5. Okay, this tidal volume will show me roughly what kind of air is moving whenever they take a breath, but it may have leaks in it, and I don't rely on this number very much, but that doesn't really give me very much information. The breath per minute is very important. It lets me know what they're doing, and I've got some alarm limits there. Obviously, there's not a patient connected to it, so I've got an apnea alarm. I shouldn't see that. So a couple of tweaks for this. If your patient says they don't get enough air from it, all right, and I'm holding it to their face and I'm helping them learn to tolerate this and coaching them. If they're not getting enough air, tweak the pressure support. All right, come up to 12. If they're still not feeling like they're getting enough air, come up a little bit more. And now I've got them at 15. Okay, if that's not the problem, they feel like they're getting enough air, but they're not oxygenating well. That's not the tweak I want to set. If they're not oxygenating well, I'm going to go down and I'm going to start bringing the PEEP up, and I'll come up to about 8 or so and give them a little bit of time to see if they do better. And if they don't oxygenate very well, I can add a little bit more PEEP if I want to. Now keep in mind that this machine is an additive machine, so this inspiratory pressure is going to add the pressure support and the PEEP together, and the pressure support is always going to be above whatever your PEEP setting is. Okay? If your patient's not getting a good breath and they're struggling to make it give them a breath, then the trigger level is set in the PIP button. So I held it down. I see the -2. Let's make it a little easier for them to get a breath. I set it at -1 and see if they can generate a breath right there. Just low tidal volumes, low breath volume, and fatigue on any COPD or CHFer is going to make it hard for them to get a breath. So if they can't get a good breath from this, they can't generate enough to get them a breath, I could even bring this down to -0.5. and they should be able to get a breath. If that's not the case, if this doesn't work, we're probably headed towards intubation, but this is something that I can do to try to get them out of trouble while I'm, in the hypertensive CHF patient, as long as I'm trying to lower their blood pressure with the nitro and doing that as often as I can do that by protocol. Then I'm going to keep providing this therapy until patients so fatigued that they're not moving enough air and we go to intubation. Hopefully we get them out of trouble before then. So that's it on setting up BiPAP.